It's 19 minutes after 8 on the AM show. The Ministry of Health has gone digital. We had that conversation. Indeed, we saw the launch. For those who don't know about it, we'll let you in on what that means. One thing you should know is that your folders are now networked and can be accessed anywhere. And when you are, at least that was the understanding. With this in place, if you are referred, your folder won't go with you physically to where you've been referred to. Let's have the conversation with Dr. Franklin Esiedubekwing, his head disease surveillance with the Ghana Health Service. Also Eric Ajay is project manager with Lightwave eHealth Care. Good morning to you, gentlemen.
Good morning, Mama V.
I think it will be appropriate to start with you, Eric. So after the launch, which facilities in Ghana is carrying out this? So where can I walk to and I'll experience what we're talking about in terms of paperless?
Okay, thank you, Mama V. After the launch, we've actually been running this project for some time now. So if you go to facilities in the central region, which were selected for the first phase, you will find this running in about 20 facilities in the central region. Kaswa Polyclinic, we have the Sopon Municipal Hospital, Swedro Government Hospital, just to mention a few, but we have a total of 20 facilities in central region with some chip compounds that are on this application.
So these people walk into the facilities with nothing?
Yes, you basically come into a facility or a hospital, and if you have already been registered in one of these centers where we started the first phase, then you don't need to carry anything to the next site. Suppose you were registered in Kaswa and then you found your way in Cape Coast and you had to go to a hospital there. The hospital will have access to your data. The doctor in question will have access to your data once they pull up your records from the system. So you don't need to get your data or folder being carried from Kaswa with you to, say, Cape Coast or Ejumakun or Swedro.
Amazing. I have to find out from Dr. Franklin Esiedubekwing how doctors are receiving this, at least from the facilities where this exists. How is that helping with the work?
Okay, then thank you very much. I think that I am talking from the perspective of surveillance. And
from surveillance?
Yes.
As in you're monitoring the system?
Yes.
Okay.
Because we are looking at the kind of data which is collected in the facilities on real-time basis. And our pride in the application is that we're able to assess the information as it's being put into the system, which is real-time surveillance. The idea is that you need information to take action. So the doctors there who are using it, the only issue is that now it's kind of limited. So from my point of view, that I sit at the national and look at the whole Ghana, I would say that this is the early stage of it.
Okay.
Because it's just, let's say, 20 facilities.
A small
yes, over,
bit.
let's say 5,000. So going forward, we are convinced that if you have such a platform, then I can sit with my team in Accra and at a point in time T, know what is happening across the country. So that is what we pride ourselves in. So I think that is good, that is more.
Okay, so let's even talk about the very small where it exists. What are you able to monitor from your desk?
Yes, what you are able to do is that, you see, as the doctors put in the data, you are able to track it to see whether it's going above a threshold to take an action. What this system does, which to me is an advantage, is that it's also have an alert system. So the alert system is actually using symptoms. Our current system, you use the disease or a condition, but this one you can use it using symptoms. So if I set an alert, let's say that you have diarrhea, and let's say on admission, as we are alerted, then any person who comes to the facility who has diarrhea and is on admission, I'm alerted. The thinking is that I'm thinking it could be cholera. So then an email will be sent to me, and then we need to now take an action.
Okay.
So that's an enhancement of our current system that we are practicing.
Okay.
So to me, that is a plus that this system has. And also, we can be able to monitor events on a daily basis. So which is also a plus. In the time past, if you look at the manual system that we used to run, the cases, doctors will see the cases at the end of the day, and then somebody will go and look through the register to see whether there are other conditions that could be prompted to lead an outbreak. But this one, as I enter the system, I can actually see which ones are alerting me to take an action.
You can also actually monitor the number of patients that even went through a facility at any point in time.
Yes, and then particularly where they are coming from. So it's an action that you need to take. Assuming you have so many people coming from a locality, if we are pointed that something is happening in that locality, that's why they all come to the hospital. So these are positives that will help us in surveillance.
But Eric, are we also not exposing a lot of data through this process?
I wouldn't say yes, because what is happening is data that is being transmitted from facility to facility is protected under the Ghana data protection law, and also it conforms to the HIPAA, which is globally way of being able to safeguard patient records once you go electronic. Each site operates monotonously. They have a server that keeps all their data. The only time it reaches to another site is when data is being requested from that site by a particular doctor. And the system has audit trail as well. So every doctor or every person that accesses a patient's data, there's an audit trail for what it's used, for what you did with it, what you entered. Everything is being monitored.
So you said you've been piloting with about 20 facilities in the Central Region, correct?
Yes.
Okay. What are the plans in terms of expansion?
Yes. In terms of the expansion, we are looking at going on the more populated areas and the bigger facilities, because that is where you have the chunk of people that can also help the disease surveillance aspect.
So when you say bigger facilities, you're still talking Central Region, the main Central Region hospital, for instance, or what?
No.
Okay.
Spreading out, when we look at Ghana, we have 4 teaching hospitals and we have regional hospitals. So we'll be targeting those areas in the expansion project, because we've now been able to assess the lower facilities, and we have also included the Cape Coast Teaching Hospital as well. So we know the terrain in which...
so the Cape Coast Teaching Hospital now is covered under this?
Yes.
The system is running there?
The system is running. They're actually starting paperless from the 1st of December. We've trained, we've done everything. They are going live, because they have to run. You cannot immediately shift from the old system into the new. You have to run concurrently, and then you smoothly move into...
So that's what they've been doing. Because I was going to ask, so somebody has to physically transfer all the data onto the computer now?
Yes, as you enter the facility, normally what we do is we take the existing patient record and update your system. So when you have older patients coming to your facility, you don't need to register them again. You search for them, and then you update their records. Since records are taken from the OPD directly through to IPD, you don't need to be registering again. It's once and for all. So if you have been registered in Kasua, you don't need to register again in Cape Coast Teaching. When you get there, they search for your name. They can use your NHIA number. They can use your health facility number, your name, your cell phone number. Anything that were used in registering can be used in tracking you.
Doc, how does it help NHIA in any way?
Yeah, I think that there are challenges with fraud in the system, and that this current system has a lot of inbuilt advantages that you don't just go about inputting data, because you need to prove that somebody has actually come to the health facility, has actually been put on this diagnosis and has this medication. So you realize that by so doing, you are clear in your mind. So when it comes to making a claim, there's an evidence of it which is electronic. So you cannot just add onto it. So somehow, this system will cut down the fraud that is being experienced in the system.
Is it in terms of your office direct? Is this one of the things you'll be monitoring?
No.
Okay.
I believe what we are trying to do is that, you see, there are several alert systems which are inputs in the system, like they have drugs. So you can even set an alert on the drugs which are being used in the facility, which can alert us. So I think that this system has a lot of opportunities, because it is very modern and takes into cognizance the technologies around. So you can track several things that are not routinely tracked. Because one of the systems that we have in Ghana is our surveillance system is fine, but it's not, let's say, it's not optimal. So we were advised to improve on event base. So events could be the number of prescriptions being prescribed at a point in time. So we think that this system will help us to early detect cases. And to us, the focus is about early detection of diseases that even if they occur, it will be minimal.
So now that it's in a small place in the central region, am I right in saying that, because there are 10 regions?
Yeah,
when should we expect? We made a lot of noise about this.
Yeah.
Indeed, the launch was big, so people are expectant. When would it come to my hometown, the Volta region?
All I'll say is very soon, because very soon we'll be spreading out through the whole of Ghana. You'll be hearing more in the news. The disease surveillance aspect, like he said, we are actually going to fast speed that one, because what is going to happen is there's going to be a mobile app where the health facilities information officers will be able to, when they go out on the field, will be able to track diseases and events that are occurring and feed directly into the system.
Okay. Yeah. Any initial things that you've picked from at least these 20 facilities? Anything of interest?
Not really. We had a few cases of suspected cholera, but they were not actually confirmed. So I think that it's early days yet. I think this is somehow a capital-intensive project. So I think most of the decisions will be done by. That's why the launch was by the chief of staff, because you need to have a clear buy-in, and then it can be cascaded. We are, as a technocrat, I see that it will enhance our work. So I keep on saying that we do not work for the company. We look at what it can bring to us in our surveillance system. We think that because it has a real-time component, that an event occurring can be detected. To us, it's a good plus. And also because of the symptoms that can be monitored, it's also a good plus for us. So we are for it. We hope that the capital component will be addressed, and then to be scaled up to get the best effect of it.
Any challenges so far with what you've monitored in terms of the other side, in terms of the system?
Yeah, you see, because this one is a pilot, it's difficult to talk about the obvious challenge. What you're going to see is, you know, not every part of Ghana, let's say, is networked. So that has a challenge. But then the app has an offline component. So somehow the data can be collected, and then we can, when they have access, it can be accessed. Though there will be a slight delay, but somehow it will address the challenge. So I think because Ghana doesn't have total penetration of internet, it comes with some challenges, and hopefully the app is going to address it with the offline mode.
Okay. All right, we've got to wrap up, but anything more that you want to add?
Yes, especially on the NHI issue, the system is able to check in real time the validity of NHI card holder. You don't need to physically look at a card to identify, because there have been instances that cards that have expired are supposed to and have a start date. Okay, and physically, if you look at it, they tell you the start date is this, but then going into detail, you realize sometimes they give you 30 days before you can start using the card, because they will print on the card for you the date of expiry, and that's where it starts from. The system is able to check all this, so if your date of use is not up, you are not able to use it.
So it means that this is not just, NHI is involved in this?
Yes.
From your point of view?
Yes.
Okay. All right. So what can Ghanaians do? What should we do? How should we support this?
Yes, I think that from our point of view, we think that it's a good system. And the government needs to invest into it. It's going to enhance early detection of
so we should push governments.
No, I think somehow the government has budgeted. I mean,
we should put a bit of pressure. No, you won't say it, but we are
advising, let's say, the central government.
Yeah.
To me, I think that is a good activity to invest in.
Yeah.
So I think the government is willing to do that.
Okay. I think it's refreshing when we hear from technical people and not necessarily the politicians, especially when we are entering into something like this. So it's good to hear from you. Thank you very much.
Thank you.
I'm not taking you there. Eric, thanks for your time as well. And Eric Ajay is project manager with Lightwave eHealthcare Solutions. Dr. Franklin Esiedu Bekwing is head disease surveillance with the Ghana Health Service, talking from his angle how this whole paperless, I think generally for all of us, we know it as paperless, but how it's going to help in detecting diseases and other things early enough. But we hope that this will soon spread across. That's what we're hoping for. Thank you, gentlemen, for passing through. Now, Love Divine Ministry is bringing a seminar titled My Marriage, My Ministry. And the speakers include our own Amos Kevin Annan and Gifty Ando Apia. What are you to expect from this? A conversation is coming up right after this.